Welcome to the Heart of Healthcare with Dr. G. This is a podcast that is unafraid to address current issues regarding top healthcare needs and concerns. Welcome to At the Heart of Healthcare with Dr. G. We want to go ahead and open with our prayer of the day. That's who's guiding us through all of these podcasts. This is from Jeremiah 30:17. But I will restore you to health and heal your wounds, declares the Lord.
Amen.
Well, thank you so much for joining us. This show is unafraid to address everything that we just mentioned before. And today we're going to talk about how home health and hospice are paid for. We've already talked about hospice. We've talked about home health, right, Dr. G?
Talked about palliative. Don't forget my baby.
That was your baby. I wanted you to talk about that one. No, and you did. So today we're going to actually go and discuss a little bit more about how it's paid for. But before we get there, what I'd like to do a little bit is I'd like to tell our audience a little bit about you. And just kind of offer them. I was intrigued by your story and everything about you becoming a doctor. So let's share that a little bit, Dr. G.
All right. Well, I'm Kayshana Guidry, MD. I just became a doctor in 2016. What is that, 5 years in?
Yeah. You're 5 years?
I'm 5 years in. And I have this photo here. You can see it. This is my graduation day from Texas A&M. Shout out to my College Station school. So my family, we moved to Texas, came back, we're Californians, but we did have a wonderful time. We had a wonderful time there in Texas. You know, we got a taste of that Texas football. Both of them, they won state championships, band championship. We were in a great community in Cedar Park, Texas. We still stay in touch with a lot of folks.
Right.
And so it was a great journey, but I have this picture here because it was the culmination of a great thing, and it's always wonderful when a mother feels her kids are proud of her, and you know, we don't often see that. You know, when my kids were small, while I was a stay-home mom, they would run to the door every day. Daddy's home. But you know, we don't see that. But for this, they were like, my mom. So
she did it.
These are my kiddos. I'm in the middle, obviously. I have a wonderful, supportive husband. I have my oldest, my firstborn. He's 20. How old is he? 22?
22.
22. Thank you. 22, professional football player now. I have my second son, Elisha. Go Bruins. He's following in his parents' footsteps because we're college sweethearts, and studying economics. Actually, he'll be doing internship on investment banking.
Oh my goodness, I need to call him up.
Smarty pants. He's gonna buy me a yacht. We can go together.
We'll go together.
And my princess Kayla Grace, she's pre-med. She kind of shocked us with that. I didn't force her, but she is a pre-med student, and they're just wonderful little people, and they inspire me every day. And my husband, who's there, these bracelets, if you've wondered, I've been wearing these every week. This is for his program because during the pandemic, and he pivoted his career, wrote a book about living in greatness because that's what we do, and also has a program that accompanies it. But the book is for parents to talk about how to use sports to bring out the greatness in your children. It's called Warrior Parent Playbook. Shout out for that. So this is me supporting it because this is literally my life from that. So anyway, that's about me.
It's not enough yet. I've got some questions, and I think our audience does too.
You're mini Barbara Walters, so I'll just be ready.
So are you able to share with us what team your son plays for? Because professional, I caught that word. Did you guys catch that word?
Yeah, he's a New York Jet. We call him Jav the Jet, but hey, we know that can change at any time.
That's right, but you know what? The Almighty's got something going on.
Yeah, the business goes. They trade folks all the time. time, but
Right.
at this day, he is Jav the Jet. So I'm looking forward to getting to a game and actually seeing him live his dream.
This
With
year, right?
COVID, they played in empty stadiums, and I tailgated on my couch for the first time in
Bet you
many
did.
years because I am a football mom. If you follow Dr. Mama K, you'll know that I'm a football mom, but Dr. Mama K missed games all last
I
year, but
bet
it's
you
okay.
did.
We're grateful to be here
Yeah.
and all vaccinated and ready to go somewhere.
Absolutely. And that is just, I tell you, it's so inspiring. And your story of taking, what made you decide to take that leap and become a physician at the stage of your life that you did? Because a lot of people might have thought that was cuckoo.
Yeah. So, that's the question that I would get so many times. And it was actually, my personal statement for residency. I opened it. Whenever people find out I'm married with 3 kids, they want to know what made you go to medical school. And
Yep.
so that's a story that I've learned to abbreviate. I have to give a shout out to my doctor mom, Dr. Beckles. She'll be listening. And so she's a friend of mine. We went to UCLA together. She just an amazing woman. She's a family physician now, but while we were in college, we developed a friendship. Her daughter was my flower girl. She went to medical school. We talked on the phone. We just did a lot together.
Right.
And so when I decided to get back out to work when my kids were bigger, it's about the time when Kayla, when I say my youngest was 2-3 years old.
Okay.
And I said, hey, what am I gonna do? Because at some point you realize being a stay-home mom, it's wonderful, and it was a choice that I made. But at some point they're at school,
Right.
and the house is clean, so there's still contributions to make. For me, at least.
Well, yeah, and I think a lot of our stay-at-home moms that might be listening to this can really, understand that, because once their last one is getting ready to go to school or growing up, you definitely are going to look inside yourself. That's interesting.
Definitely. And it was also just nudges. So there's a couple nudges. So I remember driving around Long Beach in my Suburban, and this is touching on that mom guilt thing that I don't believe in. My kids, while I was driving in the car, they said, hey, we want to go to the babysitter like our friends. And I was just like, appalled. Not that I didn't go to the babysitter, and nothing wrong with having a babysitter and all that stuff. But I had, done all this stuff, and I said, wait a minute, they don't even appreciate it. I'm going to do whatever I want. So that was something that kind of pivoted me a little bit. And then once I was volunteering in the community, I volunteered at a pregnancy health center, loved childbirth. I actually thought I was going to be an OBGYN. That was the thing. And so I started taking some courses at a community college, Long Beach City College. I got to give all those shout outs.
Right.
Because I believe in community college. I became a tutor there, helped a lot of people. But so I went there, and I took some courses. I was going to get into nursing, and so I fell in love with the science. And long story short, some friends of mine and mentors said, hey, you're really, really into this. I see you light up when you talk about these things.
Wow. And you had were they girlfriends?
It was that person I mentioned, Dr. Beckles. So she's like, wait a minute, like, how do you know how to pronounce all these words, and you're just really into this? Are you sure you want to go to nursing school? Nothing against nurses. Everybody on the medical team has a role.
Right.
But she, knew me personally, and she thought that, I probably wanted to take a different role, in the healthcare system. And so she did that. It was the kindergarten teacher did that. One of my friends at Bible study did that. And then finally, another friend of mine who was in the classes with me, she's actually an ICU nurse, she said, you shouldn't do it because you won't be happy, because you're going to want to do this and you're always going to have something to say. And they were
Boy,
right.
they were right.
Boy, they were
And
right.
you know, the Almighty was definitely looking after you too.
Yes, because
With those friends, we need friends like that to
Yeah.
really lead us and make sure that we can really listen to what the Almighty wants us to do. Because boy, oh boy,
at the end of the day, yeah, they were absolutely right. And being here is kind of like full circle at the heart of healthcare, where I found my niche, in end of life care, hospice, and palliative care, and having this podcast to be able to speak to the community to empower them. I do have something to say, and so here we are.
Right.
I love it.
Well, I'm hoping that a lot of women are going to be empowered by your story, because oftentimes, we might not think about going for that other bar, that other goal, and just, thinking, oh, I'll just stop here. And like you said, there's nothing wrong with that at all, because like you said, everybody's got a spot. But I think that it's so encouraging to hear you. And for all of you out there that actually might have this yearning for this, it's the Almighty telling you it's time to do something with that. And I think that's interesting. So how old was Kayla then when you went to med school?
When I went to med school, she was 11. All my kids were like short and right before puberty, so that's what it was.
Wow.
And then you see when we came back, they were all
they were, yeah.
But yeah, to your point with, the mothers out there, and I'll say this, I remember this quote that struck me so hard. While I was applying to med school, the Oprah Winfrey Show was still on. So that was our treat. Every stay-home mom knows that. And it was while she was doing her last lecture and all that stuff, I was penning my personal statement. But something she said in some of those last episodes were to the effect of, every job, whether it's a doctor, a social worker, whatever it is, falls under the order of mother.
Oh my gosh, that is beautiful.
Yeah, so those are the skills, all the skills that you use to manage a home, to take care of your family, communicate, conflict resolution, all those things that we do, they translate. And so that was what I did. Absolutely.
I think the only difference is maybe the paycheck.
Yeah, I told my kids, though, they owe me money.
So maybe they need to build you a house
and buy me a yacht. They already know.
I like that. Well, what a wonderful story. And I hope that you all find that as inspirational as I did when I met Dr. G for the first time. It really touched my heart. And it's wonderful, and I hope that it does yours as well. As I mentioned before, we're going to talk a little bit more about how home health and hospice care is paid for. And actually, they're paid for the same way as we've discussed in the past. They're paid for by Medicare. Both home health and hospice are covered by Medicare. Also, both of them are covered by managed care or senior plan. And then also they're covered by commercial. So hospice care really pretty much mirrored pretty much what home care did, home health care. So home health being able to be reimbursed by all of those different mechanisms. And then in different states, we've got Medicaid. And so Medicaid stepped up and said, wait a minute, if Medicare is doing this, then we really want to go ahead and make sure that we mirror exactly and do a very similar thing. So it really does a world of good for individuals that really need these benefits, because these are benefits that are, when the individual needs them, they are just perfect at that time. And you and I have discussed a lot about that. We've discussed hospice and how they pay for the different equipment, medications, they pay for oxygen, all of those different kinds of things. For the doctor to come out, that's you, or one of our medical directors actually, to come out. And you've been so helpful in all of that as well. And then how it also, it will help for, different parts of incontinence supplies, or, that kind of a thing. So hospice is great because it's always pretty inclusive. A bed, all of that stuff. Home health, unfortunately, that's got to be ordered by the doctor. And we didn't touch on that in the past, so I do want to make sure that we touch on that now, that home health, actually, if they need a bed, they've got to qualify under particular regulations. We did talk about oxygen. They have to, actually qualify for that as well. But for the most part, all they've got to do is go back and get a doctor's order. And under our program, our palliative program, which we also run under our Blue Shield, or out here in California, we have a program that's called IEHP, Inland Empire Health Plan, and you have several different kinds of things like that across the country. That program, actually, they're paid for by those two benefits. And you do a lot with those patients and those families. And what I love, what's so unique with the palliative program, and we touched on this before, is they can call us anytime, right?
Mm-hmm. Yeah, we our sponsor, shout out to Destiny Hospice, Palliative Care, Home Health, for our palliative patients that come onto our Destiny program. They have the wonderful benefit of 24-hour service. Obviously we're here 9 to 5, the phones are ringing, hear them in the background. The team is over there working their buns off, but once we do stand down, everybody goes home. If something goes awry, 7 o'clock, they can call our 800 number and someone will answer, and a nurse can come out and they report back to us. We just have a wonderful team, communicate well via Tiger text, and they have that. And so that's what I always tell them, because I meet every patient that we bring on, and I remember last week I said, well, do you have any questions? And a lady said, well, why do I need you guys? And I told her,
oh, that's
I said,
good.
well, with Destiny, you get to call us, and we can help prevent hospitalization. We may be able to do something. And you have the hospice team that's on call. You have our 24-hour hospice physician that's on call that can field the question. So it's very beneficial.
Yeah, no, I think that's great. And the other thing with the palliative team that I like is, and it sometimes is just so helpful, any age,
Mm-hmm.
and they can seek all that aggressive treatment. And we talked about that in one of our other podcasts, where it doesn't matter what they've got going on, we're going to help them do the symptom management, and you help a lot with that, and getting them the things that they might need, nausea, vomiting, all of that nasty stuff, right?
Right, and the care coordination. So not only can I step in and do prescriptions for things like that, or coordinate with the primary care to fill those prescriptions, we're also ensuring that a patient, for instance, have they followed up with their PET scan for their oncology workup,
That's a
before they
really
have their
good point.
follow-up.
Yeah.
Have they made their appointment? For our bedbound patients, do they have transportation to get to that neurology appointment? So just so many things. I think we take the headache out of it. And that's what palliative care does. We reduce the stressors of chronic disease, not only do the symptom management, but reducing the stress, the psychosocial stressors. We have someone who's experiencing homelessness right now, so we're providing resources for them.
Yeah.
So we do a lot, and it's very, very fulfilling.
Absolutely. And our jobs are not easy, just like a lot of the folks that are on the front line. And sometimes I think with this pandemic, patients and families don't respond, and oftentimes, they've got so much going on. Last night we had a horrible situation where one of our nurses had a gun pulled on them. And that was just, thank goodness nothing tragic happened. But I think that, the caregiver was not exactly right. And, we never know these kinds of things when we're going in. But, this is the thing that we do. And this is the thing that in your neighborhood or in your city or your county or your state, that's what they do. When you're going out and you're getting home health and you're getting hospice and you're getting palliative care, these are the things that are important. And you might not ever know what we're being faced against. And sure, this was a first time for us, actually. So thank God, nothing bad happened. But, at the end of the day, our nurse was very, very, shaken, of course.
I was shaken when I read that.
Well, it was really rough, and of course, they have two small children at home, so to see your life flash in front of your eyes. But this is what frontline workers do, and that's what these programs are about. So I cannot reiterate that enough, and I want you all out there to really not only accept these benefits, but know that these are folks and nurses and doctors and social workers, therapists, everybody that does this job does it because they've really got a heart for healthcare. And when Dr. G came up with the title for this, At the Heart of Healthcare, and I want you all to know she's so humble. She did not want her name in this, but I said, absolutely, it's got to be At the Heart of Healthcare with Dr. G. That's what it is.
Okay.
But, the folks that do these jobs, they really, really have a heart for this, because you couldn't go into people's homes. Or you talked about the homeless person that we've got on right now. I mean, I'm trying to figure all of that kind of stuff out. If you didn't have a heart for what you do, or you didn't believe that there was the Almighty above that's just guiding us to do the job that we do every single day, it just couldn't get done. And I think that's true across the country.
Yeah, because you have to approach these situations, without judgment, without any moral labels on it, and I guess that takes, having a background where you've seen lots of things, so nothing surprises me.
No.
Mm-hmm.
And I had one family calling up to get them all situated, just got the referral. It was definitely a tough case. It was Lou Gehrig's disease, and the wife almost didn't take, it was her husband, almost didn't take the care. And I said to her, I said, what is it that's holding you back? What are you thinking? And she said, I'm worried because my house isn't clean. I haven't had a chance to clean my home. And we're not there to judge, just like what we are talking about in general. This is no judgment. This is all about care.
Yeah, I've seen that too. Sometimes they say, oh, I need to, I'm not ready. I said, well, you don't have to cook me dinner. And then that makes them laugh, and then they're fine. So, yeah.
Yeah,
Mm-hmm.
that really, I love that. And I love that across the country, that organizations just like us, whether it's, hospice or the home health or the palliative care, that they recognize that these are just families trying to make it work with the resources that they have, and sometimes not even knowing everything that's available to them. So I hope that all of you that are listening to this can pass on some of this. We're hoping it's great information to folks that might really need it, because right now a lot of people are really struggling. In each state, as I mentioned before, Medicaid is a very big part and does cover for home health care services as well as the hospice services as well. So I think that that's really important. And I just want to touch on that again. So, we've got the commercial insurances for the younger folks. So you are not left out, and if it's an organization that takes care of pediatrics, we don't happen to take care of peds here. But if they do, and that's, we take care of 18 and older. But if it's 18 and younger, there are specialized agencies that do that. And all of these benefits are covered under commercial. They're covered under the Medicaid programs, the VA, the veteran programs, and they're covered under the Medicare program. And we're just so proud to be a part of all of that. All of those organizations are going to be accredited by some kind of accrediting body. We happen to be Joint Commission accredited. So again, I want to thank our sponsor, Destiny Home Health, Palliative and Hospice Care, because without them, you and I wouldn't be there. We know that, or be here. So we want to thank them so much for this. But in your area, you've got organizations just like this. So we're hoping that you come back next week with us. We've got another great podcast for you. And Dr. G, are you as excited as I am?
I am. This is great. Thank you for joining us at the Heart of Healthcare.
Thank you so much. If you want to reach out to us for any questions, phone number 951-316-9790. 9604. And then also we've got our email address, and I always want to just double check myself on that. It's hello@destinyhospicecare.com. Thanks again.
H-E-L-L-O.
Yes, ATLLO.
Do that cheer. You were a cheerleader.
Right. All righty. Thanks again, and all of you have a wonderful, wonderful day. Bye. Thanks for tuning in to At the Heart of Healthcare with Dr. G. Help us by rating us on iTunes, and don't miss an episode by subscribing on YouTube. And be sure to click that little bell to get notified about new episodes. We can't wait to see you next time.